there's something unsettling I didn't fully understand at first. Something that, once it clicked, completely changed the way I looked at my own health. The idea that something could already be happening, right now, without pain, without obvious signs, and without me noticing. It's uncomfortable to think about, because we tend to associate problems with symptoms. If it doesn't hurt, if it doesn't look wrong, if it doesn't interrupt our routine, we assume everything is fine, but that's not always how the body works. And when it comes to your gums, that assumption can be misleading. Gum recession doesn't usually announce itself. It doesn't start with a sharp pain or a dramatic change. It begins quietly, subtly, almost invisibly. The gum line slowly pulling back, millimeter by millimeter, exposing more of the tooth than before. But here's the part that makes it so easy to miss. You don't see it happening in real time. It's gradual, so gradual that your eyes adapt. What looked normal yesterday still looks normal today, and tomorrow, until one day, something feels different. Maybe your teeth look slightly longer. Maybe there's a bit more sensitivity when you drink something cold. Maybe your gums don't feel as firm as they used to, and that's when the realization starts to sink in. What if this didn't just start now? Because in most cases, it didn't. By the time these signs become noticeable, the process has often been developing for a while, and that's where a deeper concern begins to form. Not just about appearance, but about what this could eventually lead to. Because underneath your gums is the structure that supports your teeth, and when gum recession progresses, it can expose those structures, making them more vulnerable over time. This is where a thought many people carry quietly begins to surface. The fear of losing teeth. It's not something people talk about openly, but it's there, in the background. That awareness that something slow and unnoticed today could turn into something much harder to reverse later. And alongside that fear, there's another layer people don't always like to think about: the cost. Because once gum recession reaches more advanced stages, the treatments become more complex. Deep cleanings, specialized procedures, sometimes even surgical interventions. Not impossible, but often expensive. And often something people wish they had prevented earlier. The truth is, most people don't delay action because they don't care. They delay because they're not sure what's actually happening. They're waiting for something more obvious, something that confirms there's a real problem. But with gum recession, waiting for clarity can mean waiting too long. We've left a practical guide in the first link in the description for quick access. Click and see. Because once you start to understand how this process works, you realize something important. The absence of pain doesn't mean the absence of progression. And that changes how you see everything. It shifts your focus from reacting to preventing. The silent architecture breaking down. Think about it this way. Your gums are like the foundation of a house. You don't see the foundation. You don't think about it every day. But it's there, holding everything in place. And when a foundation slowly cracks, when it gradually shifts or weakens, you don't notice it immediately. The house still stands. The walls still look straight. Everything seems fine from the outside. But underneath, something critical is changing. And by the time you see the visible effects, cracks in the walls, doors that won't close properly, floors that slope, the damage has already progressed far beyond where it started. That's exactly what happens with gum recession. The tissue that protects the roots of your teeth is quietly pulling back. The bone underneath may be slowly resorbing. The attachment between tooth and gum is gradually weakening. But you're still eating normally, still smiling, still going about your day. So your brain registers everything as fine. And here's what makes this particularly dangerous. Once gum tissue recedes, it doesn't grow back on its own. Not the way skin heals after a cut. Not the way a bruise fades. Once it's gone, it's gone. That's the part that changes everything when you truly absorb it. Because it means that every day you're unaware, every week you're not paying attention, every month you're assuming everything is okay. The window to preserve what you still have is quietly closing. The moment most people finally notice. Let me walk you through what typically happens. Someone is brushing their teeth one morning. Same routine they've had for years. Nothing unusual, but this time, they pause. Their teeth look different. Not dramatically, just slightly longer than they remember. Or maybe they're drinking their morning coffee, and there's a sharp sensation. Not quite pain, but sensitivity. A cold zing that wasn't there before. Or they're flossing, if they floss. And they notice the floss seems to go deeper than it used to. Like there's more space between the gum and tooth. These are the moments when awareness breaks through, when the invisible process suddenly becomes visible. And here's what usually follows: a moment of concern. Then, a rationalization. It's probably nothing. I'm just being paranoid. Everyone's teeth get a little sensitive sometimes. I'll mention it at my next dental appointment, whenever that is. And just like that, the moment passes. Life continues. The concern fades back into the background. But the recession doesn't stop. It doesn't pause because you decided to ignore it. It continues, silently, consistently, in the exact same direction. And weeks turn into months. Months turn into years. And eventually, the signs become impossible to ignore. The sensitivity becomes constant. The exposed roots become visible. The gaps between teeth start to widen. And that's when the real fear sets in. Because now it's not just a minor concern. Now it's affecting how you eat, how you smile, how you feel about yourself. We've left a practical guide in the first link in the description for quick access. Click and see what your dentist sees but doesn't always say. Here's something most people don't realize. Your dentist can often see the early signs of gum recession long before you can. During a routine cleaning or checkup, they're looking at your gum line with trained eyes. They're measuring pocket depths. They're checking for inflammation. They're noting changes from your last visit. And sometimes, they see the beginning stages. But they don't always say it in a way that creates urgency. Maybe they mention it casually. Your gums are receding a bit. Keep an eye on it. Or they note it in their records without making it sound serious. Some minor recession on teeth 6 and 11. And you hear it. But you don't really hear it, because it doesn't sound urgent. It doesn't sound like something that needs immediate action. So you file it away mentally as something to be aware of and move on. But here's what that dentist isn't always communicating clearly. By the time recession is visible enough to measure and mention, it's already been progressing. The process didn't start the day of your appointment. It started months, sometimes years, earlier. And while it might seem minor now, the trajectory is already set. Unless something changes, unless you actively interrupt the pattern. Because gum recession isn't like a cold that runs its course and resolves on its own. It's a progressive condition. And progressive means it keeps moving in one direction, unless you stop it. The real culprits, hiding in plain sight. As I started paying closer attention, I realized that gum recession isn't random. It's usually connected to a combination of factors that, on their own, might seem harmless, but together create the perfect conditions for this slow change to happen. Brushing too aggressively, for example, it might feel like you're doing a better job, but over time, excessive pressure can wear down the gum tissue instead of protecting it. Think about it. Every single day, twice a day, for years, you're applying pressure to delicate tissue. If that pressure is too hard, if you're scrubbing instead of gently cleaning, if you're using a brush with bristles that are too stiff, you're literally wearing away the very thing you're trying to protect. It's like washing a delicate fabric with a wire brush. Sure, it gets clean, but the fabric starts to fray, and over time, it breaks down. Then there's plaque buildup. When it's not properly removed, it triggers inflammation. And chronic inflammation is one of the key drivers behind gum recession. The body reacts, the tissue weakens, and slowly it begins to pull back. This is where things get more complex. Because plaque isn't just a cosmetic issue. It's a living biofilm, a colony of bacteria that constantly produces toxins and acids. And when those toxins accumulate along the gum line, your immune system responds. It sends inflammatory signals. White blood cells rush to the area. The gum tissue swells slightly. And this inflammation, when it becomes chronic, starts to break down the connective tissue that holds your gums firmly to your teeth. Day after day, week after week, the attachment weakens, and the gum line starts to recede. Even something like grinding your teeth, often done unconsciously during sleep, can contribute to this process by placing constant stress on the supporting structures. You're not aware you're doing it. You're asleep, but your jaw is clenching. Your teeth are grinding against each other with significant force. And that force doesn't just affect the teeth themselves. It affects everything around them. The periodontal ligament, the bone, the gums. Over time, this constant trauma can cause the gum tissue to pull back, almost like it's retreating from the pressure. And just like that, what feels like unrelated habits start connecting. Diet, stress, oral hygiene technique, consistency, None of them act alone, they build on each other. The hidden role of inflammation. Let's pause on inflammation for a moment, because this is where things get really interesting. Most people think of inflammation as something obvious, a swollen ankle, a red painful cut, something you can see and feel. But chronic low-grade inflammation is different. It doesn't announce itself. There's no dramatic swelling, no obvious redness, no pain that makes you stop what you're doing. Just a subtle, persistent immune response that gradually damages tissue over time. And in your mouth, this kind of inflammation can be happening right now, without you knowing it. Your gums might look relatively normal. They might not bleed every time you brush. They might not feel sore. But underneath the surface, the inflammatory process is active, breaking down collagen, weakening the attachment between gum and tooth, creating an environment where recession becomes almost inevitable. This is what makes gum recession so insidious. It's not just mechanical damage from brushing too hard. It's not just plaque accumulation. It's a complex biological process driven by inflammation. And inflammation can persist for years without obvious symptoms. Here's where it gets even more concerning. Chronic inflammation in your gums doesn't stay in your gums. Research has shown connections between periodontal inflammation and systemic health issues. Heart disease, diabetes, respiratory infections, even pregnancy complications. Your mouth isn't isolated from the rest of your body. It's connected. And chronic inflammation in one area can influence inflammatory processes elsewhere. So when you ignore receding gums, when you dismiss it as just a cosmetic issue, you might be missing a much bigger picture. The lifestyle factors nobody talks about. Now let's talk about the things that don't get enough attention. Stress. Most people don't connect stress to gum health. But think about what happens when you're stressed. You might grind your teeth more. Your immune system becomes less effective. Your body produces more cortisol, which can interfere with healing and tissue repair. You might neglect your oral hygiene routine because you're overwhelmed. You might eat more processed foods for convenience. All of these factors, they don't just add up, they multiply. Stress doesn't cause gum recession directly, but it creates conditions where recession is more likely to occur, and less likely to be noticed or addressed. Then there's smoking. This one is more obvious. But it's worth emphasizing how dramatically smoking accelerates gum recession. Nicotine restricts blood flow to the gums, which means less oxygen and fewer nutrients reaching the tissue. The chemicals in tobacco interfere with the normal function of gum tissue cells. Smoking also masks symptoms. Smokers often don't experience bleeding gums even when significant damage is occurring. So the warning signs that might alert a non-smoker simply aren't there, and the recession progresses faster and farther before it's detected. Diet plays a role too, not in the dramatic way people might think, but in the subtle, cumulative way that matters over time. A diet high in sugar feeds the bacteria that produce plaque. A diet low in vitamin C can weaken gum tissue. A diet lacking in calcium and vitamin D can compromise bone health, including the bone that supports your teeth. None of these factors will cause your gums to recede overnight, but over months, years, decades, they shape the environment in your mouth. And that environment either supports healthy gums or it doesn't. We've left a practical guide in the first link in the description for quick access. Click and see. The psychological barrier. There's something else happening here that's worth acknowledging, a psychological component that makes gum recession particularly difficult to address. It's the gap between knowing and acting. Most people, when they learn about gum recession, have a moment of clarity. Oh, this is actually serious. I should probably do something about this. But then, life continues, and that moment of clarity fades into the background noise of daily responsibilities. Work deadlines, family obligations, bills to pay, errands to run. And suddenly, changing your oral hygiene routine feels like one more thing to remember, one more task to add to an already overwhelming list. So people fall back into familiar patterns, not because they don't care, but because change is hard. Especially when the problem feels distant, especially when there's no immediate pain, especially when the consequences feel abstract and far away. This is where understanding the psychology becomes as important as understanding the biology. Because if you can't motivate yourself to act, all the knowledge in the world won't help. So let's reframe this. You're not adding more to your plate. You're protecting something you already have. You're not starting from scratch. You're building on what you're already doing. Small adjustments, not a complete overhaul. Because the truth is, preventing gum recession doesn't require perfection. It requires consistency. And consistency doesn't mean doing everything perfectly. It means doing the right things, regularly, even when they feel small. What actually works? This is where awareness becomes powerful, not overwhelming, not complicated, just clear, small. Informed actions start to make sense. Gentle brushing instead of aggressive scrubbing, paying attention to the gum line instead of just the teeth, making flossing a daily habit, not an occasional one. Let's break this down into practical steps. First, your toothbrush. If you're using a hard-bristled brush, stop. Switch to soft bristles. They're just as effective at removing plaque, but far gentler on gum tissue. And technique matters more than force. You're not scrubbing a floor. You're cleaning delicate tissue. Hold your brush at a 45-degree angle to your gum line. Use gentle, circular motions. Let the bristles do the work, not your arm strength. 2 minutes, twice a day. That's the baseline. But here's the part people often miss. Those 2 minutes need to be thorough, not rushed, not distracted. Actually paying attention to what you're doing. Reaching all surfaces, especially the areas along the gum line where plaque accumulates. Second, flossing. This is where most people struggle, not because it's difficult, but because it feels tedious, and the benefits aren't immediately visible. But here's what flossing does that brushing can't. It removes plaque from between teeth, where your brush can't reach. It cleans below the gum line. It disrupts the bacterial colonies before they mature into harder-to-remove calculus. Once a day, preferably at night, before bed. That's all it takes. But it has to be daily. Flossing once a week doesn't provide the same benefit, because plaque forms continuously. And if you only disrupt it occasionally, it has time to organize, mature, and harden. Third, regular professional cleanings. Even with perfect home care, some plaque will mineralize into tartar. And tartar can't be removed with brushing or flossing. It requires professional instruments. Every 6 months is the standard recommendation. But some people need more frequent cleanings. If you're prone to buildup, if you have a history of gum disease, if you have risk factors like smoking or diabetes, your dentist or hygienist can help determine the right frequency for you. Fourth, pay attention to inflammation. Do your gums bleed when you floss? That's not normal. That's a sign of inflammation. And inflammation, as we've discussed, is a key driver of recession. If your gums are bleeding regularly, that's your body telling you something needs to change. It might mean you need to improve your technique. It might mean you need more frequent professional care. It might mean there's an underlying issue that needs to be addressed. Don't ignore it. Don't normalize it. Treat it as the warning signal it is. The power of early intervention. Here's what changes when you catch this early. When gum recession is in its beginning stages. When the tissue has just started to pull back. When the bone underneath is still intact. You have options. You can stabilize it. You can slow it down. You can prevent it from progressing to the point where surgical intervention becomes necessary. But if you wait, if you let it progress, those options narrow. Advanced recession often requires grafting procedures. Tissue has to be taken from elsewhere in your mouth, usually the roof of your mouth, and surgically attached to the receded area. It's effective, but it's invasive. It's uncomfortable. It's expensive, and it requires significant recovery time. Wouldn't it be better to avoid that entirely? To catch it when simple changes to your routine are enough? To intervene when the damage is minimal and reversible? That's the power of early awareness. That's why paying attention now, even when everything seems fine, makes such a profound difference. The financial reality. Let's talk about cost, because this is a factor that affects decisions, whether people admit it or not. A toothbrush costs a few dollars. Floss costs a few dollars. A routine dental cleaning, depending on your insurance, might cost anywhere from nothing to a couple $100. Compare that to the cost of treating advanced gum recession. Scaling and root planing, $500 to $4 depending on severity. Gum grafting, $600 to $3 per tooth. And if bone loss has occurred, bone grafting can add thousands more, not to mention the time involved. Multiple appointments, recovery periods, days off work. The financial impact extends beyond just the procedure cost. And here's the hard truth. Many people delay treatment because they can't afford it. They see the problem developing. They know they should do something, but the cost feels prohibitive. So they wait, hoping it won't get worse. Hoping they can address it later when they're in a better financial position. But recession doesn't wait for financial stability. It progresses. And the longer you wait, the more expensive the solution becomes. This is why prevention is so critical, not just for your health, but for your financial well-being. Because the cost of preventing recession is minimal, the cost of treating advanced recession can be staggering. We've left a practical guide in the first link in the description for quick access. Click and see what you can control right now. Let's bring this back to what you can actually do. Right now, today. You can't change what's already happened. If your gums have already started to recede, you can't undo that. But you can change what happens next. You can decide that today is the day you start paying attention. That today is the day you stop ignoring the subtle signs. That today is the day you commit to protecting what you still have. It doesn't require a dramatic life overhaul. It doesn't require perfection. It requires awareness and consistency. Check your toothbrush. Is it soft bristled? If not, replace it. Evaluate your brushing technique. Are you being gentle? Are you rushing? Are you paying attention to your gum line? If not, slow down. Be intentional. Add flossing to your nightly routine. Every night. Not when you remember. Not when you feel like it. Every night. Schedule your next dental cleaning. If it's been more than 6 months, make the appointment. If you've been avoiding it because of cost or fear or inconvenience, weigh that against the cost of waiting, against the fear of discovering the problem has progressed, against the inconvenience of more invasive treatment later. These are small actions, but they're the actions that change trajectories. The long-term picture. Think about where you want to be in 10 years, 20 years, 30 years. Do you want to be dealing with tooth loss, with dentures, with the limitations that come with compromised oral health? Or do you want to be confident in your smile, able to eat what you want? Free from the constant worry about your teeth? The path to either outcome starts now, with the choices you make today, with the habits you build this week, with the consistency you maintain this month. Because gum recession isn't just about aesthetics. It's about function. It's about health. It's about quality of life. And those things, they're worth protecting. Reducing the factors that feed inflammation. Supporting the natural balance inside your mouth. These aren't extreme changes, but they are consistent. And consistency is what changes the trajectory. Because once you understand what's happening beneath the surface, you stop feeling like you're in the dark. You begin to notice subtle signs earlier. You respond sooner, and that can make all the difference. Something that once felt invisible starts to become clear. Something that once felt uncontrollable starts to feel manageable. And that's where a different kind of confidence begins to grow, not just in how your smile looks, but in knowing that you're taking care of it in a way that actually makes sense. The truth about reversal. Let me be direct about something important. Gum recession, once it's occurred, typically doesn't reverse naturally. The tissue doesn't grow back on its own. This is a hard truth, but it's one you need to understand, because there's a lot of misinformation out there. Products claiming to regrow your gums, techniques promising to reverse recession, and while some interventions can help, and while surgical procedures can restore lost tissue, natural reversal is not how this works. This might sound discouraging, but actually, it's empowering, because it clarifies what's at stake. It removes the illusion that you can ignore this and fix it later. It emphasizes the importance of acting now, while you still have healthy tissue to protect. Think of it this way. Every day you maintain healthy gums is a day you're preserving something valuable. Every day you prevent further recession is a win. You're not trying to turn back time. You're trying to stop time, at least in this one area of your health, to freeze the progression, to maintain what you have. And when you frame it that way, the actions become clearer, more urgent, more meaningful. The emotional component. There's an emotional weight to this that doesn't get discussed enough. The anxiety that comes with noticing changes in your body. The frustration of realizing you could have prevented something if you'd only known earlier. The fear of what might happen if things continue to progress. These feelings are real, and they're valid, but they can also be paralyzing if you let them. The key is to channel that emotion into action, to let the concern motivate you, without letting the fear overwhelm you. Because here's the thing, you're not helpless. You're not at the mercy of some inevitable decline. You have agency. You have the ability to influence this outcome. And that's a powerful realization. It shifts you from victim to participant, from passive observer to active protector. And that shift, that's where real change begins. Beyond the mouth. Remember what we discussed about inflammation? About the connections between oral health and overall health? This is where the bigger picture comes into focus. Taking care of your gums isn't just about your teeth. It's about reducing chronic inflammation in your body. It's about lowering your risk for other health conditions. It's about supporting your immune system, your cardiovascular system, your metabolic health. When you floss, when you brush properly, when you reduce plaque and inflammation in your mouth, you're not just protecting your smile, you're supporting your entire body. And that makes every small action even more meaningful, because the benefits extend far beyond what you can see in the mirror. The social dimension. There's also a social aspect to oral health that affects people deeply. How you feel about your smile influences how you interact with the world. Whether you smile freely in photos, whether you feel confident in job interviews, whether you feel self-conscious in social situations, gum recession can affect all of these things. Not immediately, not dramatically, but gradually. As the recession progresses, as the changes become more visible, people start to withdraw. They smile less. They cover their mouth when they laugh. They avoid close-up photos. And these small behavioral changes, they add up. They affect confidence, they affect relationships, they affect opportunities. This isn't vanity. This is about how you experience your life, about whether you feel free to express yourself fully, about whether you're held back by something that could have been prevented. What this all means. So here's where we are. Gum recession is likely happening right now, in millions of people, including, quite possibly, you. It's subtle, it's gradual, it's easy to miss, but it's also preventable, it's also manageable, it's also something you can influence with consistent, informed action. The question isn't whether you're at risk. The question is, what are you going to do with that knowledge? Are you going to file it away and continue as you have been? Are you going to wait until the signs become obvious? Are you going to hope it won't happen to you? Or are you going to start paying attention? Are you going to make the small changes that matter? Are you going to protect what you still have, while you still have it? Because the truth is, gum recession doesn't have to be a surprise you discover too late. In many cases, when addressed early, its progression can be slowed, sometimes even stabilized. But that window depends on awareness, on paying attention before the signs become obvious, on understanding that just because you can't see it yet doesn't mean it isn't there, and more importantly, that you still have time to do something about it. Your next step. So if this made you pause, even for a moment, and think differently about what might be happening quietly right now, that's a good thing. Because awareness is where control begins, and control is what allows you to protect not just your gums, but your long-term health, your confidence, and your peace of mind. The next time you brush your teeth, pay attention. Really pay attention. Look at your gum line. Notice the texture, the color, the contour. Are your gums firm and pink, or are they red and slightly swollen? Do you see any areas where the gum seems to be pulling back from the tooth? Do you notice sensitivity that wasn't there before? These observations matter. They're data points. They tell you something about what's happening. And once you start paying attention, you can't unsee it. You can't unknow what you've learned. And that awareness, that's the first step toward protection, toward prevention, toward taking control of something that otherwise might progress silently for years. If this opened your eyes in any way, subscribe to the channel, because this is just the beginning. And the more you understand these silent processes, the more prepared you become to act before they turn into something bigger. You have the knowledge now. You understand the risks. You know what's at stake. The only question left is, what will you do with it?